Okay, again, this is Mike Oster, your retired and separated Army rep from the NGAUS Board of Directors. I've got Bobby Dornbos is on here with me, or outgoing air rep, who's been kind enough to kind of hang in there since she became the secretary and moved over to that position. She's been hanging out and still helping with the retired separated things and was a large part of getting this first ever, to our knowledge, Zoom call or a Teams call, whatever we're doing here today, just this virtual get together of the retired separated community. And the intention for this is to, when we're going to try to do this twice a year, and one of them will be after the annual conference / November board of directors meeting. And the intent of that will be to kind of recover down on what we did at the annual conference, because we know not everybody can make that. And then also give you an update on what kind of happened at the November board of directors meeting, if there's anything that's worthy of sharing on this platform. And then we also want it to be interactive, where you can provide some feedback and we can get into discussions and different things. And we'll kind of build this thing as we go. Since we've never done it before, we're just hopeful that we'll get good participation, good ideas, provide you some content and push some information out. That was one of the requests that we had from folks was, push us more information about what's going on. So that's the intent, to make that happen, and this being the first call. A little bit of housekeeping as far as how this will work. As you join today, your microphone and your camera were by default off. And they'll remain off unless you ask permission to come on and do something. They should stay in well, as I say that, somebody needs to be muted. But we've got folks at NGAUS that are helping with this and kind of keeping and managing it. If there's something you want to share, you should see a chat icon up at the top of your screen. You also will see a hand raise icon. If you do either one of those things, if you throw something in the chat, we'll be monitoring that throughout the call, and then we'll respond to that. If you have something you want to share with the group, put that in the chat. And then when we get to the part of general discussion that we're going to go through, we'll allow you an opportunity to come on and share some thoughts or ask a question or whatever it is you want to do in a live version. As I mentioned, this is the first one that, to our knowledge, that's ever been done. So we're going to ask for some patience. And the fact that you're here tells me that you're engaged, you want to be involved, you appreciate what NGAUS does. As we continue to try to grow and get better in this retired separated community, we will need your help and constructive feedback to try to continue to build that. So appreciate you being here. Thank you so much for taking your time. We've got, I think, 2 hours blocked. I don't anticipate it taking that long, but we'll get through the information that we have for you, share some things, and then we'll allow you an opportunity to provide some feedback or do some discussion. So with that, I'm going to turn it over to Bobby, and she's going to get us started with some intro remarks of her own and then some information to get us going. So Bobby.
All right. Thanks, Mike. Thanks, everyone, for joining us today. Super excited. We weren't really sure what to expect when NGAUS asked us how many people we should plan for. Having never done this before, we weren't sure if we were going to have 10 or if we were going to have 1,000. So it's really kind of a pleasure to see that right now 72 people have joined, 155 signed up. So the first order of business, Mike, do you want me to go ahead and talk about the new air retiree right now? Or did you want to wait until the end? Do you want to dive into the content first?
Let's do that right now, and I'll go ahead and share the document that's got some of her highlights from her resume on it.
Okay, that would be great. So at this most recent November board meeting, because I moved over to the secretary position, it means I vacated the air retiree and separated director position. We had 4 people that raised their hands to volunteer to fill in for the rest of my term, which expires this August. And the person who was selected is Major General April Vogel. She just a little bit of her bio is on the screen from the letter that she had written. 33 years of service in just about every area that you can think of. Joint Ops enlisted officer at the state federal role. Operationally, she flew C-130s as well as KC-135. She led the cyber group in Maryland. She's from Colorado, but a Maryland guardsman. Has held a number of leadership roles, culminating as the assistant AG in Maryland. And then she actually was the LL for General Hokanson as her final position, leaving the Guard Bureau. She did say that she may be able to join. I'm looking at the people on the list. April, if you are logged in, raise your hand. to say hello. I don't think I see her on here. If she joins, we'll have her just say a quick hello at the end of the session. So anyway, welcome to April Vogel. And again, keep in mind that this air retiree position will become open again in August. There will be an election at the retiree luncheon in Milwaukee this year. So we have that to look forward to. Okay, and then just kind of one more note before we get started from the board meeting is, well, I'll just save that to the end. I think I'm just going to go ahead and dive into the introduction of General Weigel. So for those of you who actually attended NGAUS this last year in Detroit, we really had an awesome guest speaker, and it was Army retired Brigadier General Maureen Weigel, who did such a great job that we decided to invite her back. The boat where we had our meeting was a little bit hard to hear, but she had some really good information to share. And she was kind enough to come back and reprise her previous performance. So we're super excited about that. General Weigel's appointed the Deputy Adjutant General for the Pennsylvania Department of Military and Veterans Affairs back in 2021. In this position, she supervises the administration of the state's veterans programs, reintegration and outreach, and veteran initiatives for more than 700,000 veterans and their dependents, which includes oversight of the Pennsylvania's 6 veteran homes. She retired from the Army in May of 2016 after having served for 25 years, and many of you probably remember her as General Langel's exec when he served as CNGB. Since she retired, she's become a small business owner and an entrepreneur, serves with numerous organizations as military and veterans advisor, and helps teach military history to ROTC and JROTC students. So anyway, General Weigel, thank you so much for joining us again and for sharing your wisdom. And at this point, I'll go ahead and turn it over to you.
Thank you. Nice to see everybody. This is Brian Natali, who's behind me. I'm actually out in Pittsburgh right now at a field office taking care of veterans. So I am Maureen Weigel, and as mentioned, I run the Veteran Affairs for the state of Pennsylvania. When we talked in August, I noticed a lot of folks didn't really realize that each state has a VA office, Office of Veterans Affairs. Our office obviously is not the federal office. The federal government and the federal VA takes care of all the medical needs and your healthcare, GI Bill. So they will pay for most of your benefits, and they will adjudicate your claims and benefits, and they run the hospitals. Our office does, I would say, almost everything else for the veteran community. And it's important that you know that every state has an Office of Veteran Affairs, and that they can help you find veteran service officers, find resources for yourself or veterans that you may know, and for the National Guard. So I'm going to cover a bunch of topics today, similar to what I talked about at NGAUS. And please stop me anytime and ask any questions. Not a subject matter expert, but we have the team here that can probably answer most of your questions. And I just want to give you a quick overview. So as I mentioned, Pennsylvania is the only state, not only, we're one of 5 states where Office of Veteran Affairs falls under the Adjutant General. In many states, it's a separate cabinet member. They might be called, the Texas has a Veteran Commission. There's a Director of Veteran Affairs in Florida. There's a Secretary of the VA in California. My title is the Deputy Adjutant General, but we all pretty much have the same role. First and foremost, we have the oversight of long-term care facilities. Not every state, but probably 98% of the states have long-term care facilities for veterans. In our state, we have 6 long-term care facilities that offer both personal and skilled nursing. Why is this important? Because long-term care is outrageously expensive. And our homes are 5-star rated, and we have a lot of support from service organizations, National Guard, Reserve Component. Our homes are actually a lot of fun, primarily males, but there are many women that are starting to come into our homes, and spouses are allowed to be in the homes. If you were to pay for private nursing care for skilled nursing, it could cost you upwards of $10,000 to $15,000 a month. But if your service-connected disability rating is 70% or higher, your veteran, the VA will cover the cost of care for the nursing home for the majority of veterans, not spouses, but majority. You don't have to have service-connected disability to come into the nursing home. And in Pennsylvania, National Guard retirees and National Guard servicemen and women can also come into the nursing homes, the long-term care homes. So I just want to make you aware that many of the homes have that. And after this, if any of you want to know how to reach your point of contact in your state, I'm happy to connect you to the resources and contacts in your state. The other side of our Veteran Affairs Office is outreach. We make sure we work with all of the service organizations, your American Legions, your VFWs, your DAVs, and we make sure that all of their service officers are trained and accredited to help you do your claims and benefits for your compensation through the federal VA and your state benefits. Many states have additional benefits for veterans. So you might be 70, 80, or 100% service-connected disability receiving funds from the federal government. In Pennsylvania, we have additional pension programs, and every state has different programs. So in Pennsylvania, we have a blind and paralyzed pension. We have real estate tax exemption for veterans that are 100% service-connected. So I would go to your state to find out what other state benefits they have. And we make sure every county in Pennsylvania has a director of veteran affairs. Not every state has that. We have 67 counties in Pennsylvania, and we train all of those service officers, again, to make sure that they know how to take care of the veterans that walk into their office. We want to make sure we have someone that can take care of veteran in every zip code. And most of your states have county directors as well. And then we work with our sister agencies. The funding that comes into these states come through the federal government, 2 different state agencies. HUD-VASH vouchers for folks needing housing assistance and rent assistance comes through in Pennsylvania, the Economic Development Department. Programs for suicide prevention and, alcohol and drug addictions come in through different agencies. So we work really closely to make sure we understand what resources come into the Commonwealth and in your state, to help get veterans access to care. People ask me all the time, what is the #1 issue for veterans across the country? And the answer is awareness. Many people do not realize when they leave active duty and they're away from a military installation that the states have a lot of additional resources for you. Some of them, it comes in the shape of like grants. If you want to start your own business, there's a lot of money for grants for veteran small business owners. There's many funds available for veterans who are looking to start their own businesses or that are trying to move up and change their career field. There's a lot of opportunity. So there's so many resources in your state. The issue is that there's not a lot of awareness on how to access those. So I would really tell you all, find your state Office of Veteran Affairs and learn about the programs available in your state. And I say this because as a former National Guard officer, I see many current National Guard servicemen and women that come to our food shelters, that come to our housing shelters, that don't know where to find the help, or they're too embarrassed to tell their commands. So I really just like to educate everybody where to find the basic information so that you can help a serviceman and women in need. If you see a homeless veteran on the street and they want $1 because they say they're homeless, if they asked you where the closest shelter is, you should be able to tell them because those resources are online and available. So I just want to make sure you know how to access all of that information. I was asked in August to talk about 2 topics in particular that I'm going to cover now, and that's PACT Act, toxic burn pit exposure, Agent Orange, and also TRICARE, Retiree, TRICARE and Medicare. So I'll start with the PACT Act. Over the past 2 years, you've probably seen a lot of commercials and information talking about toxic burn pit exposure, Agent Orange exposure, and an act called the PACT Act. We'll provide some information afterwards online on this, but what that did is really looked at Agent Orange for Vietnam era veterans. As you know, many Vietnam veterans for years were denied service-connected disability from being exposed to Agent Orange for years. And then they had to really do a lot of paperwork to try to prove that the cancer they had was caused by their exposure to Agent Orange. So the federal government and this act has a list of presumptives, different cancers, different high blood pressure, different conditions that they're now saying, if you were not only in Vietnam, but countries surrounding Vietnam, on a ship off the coast of Vietnam, flying over Vietnam from another country, you are now, it's going to be presumed that you were exposed to Agent Orange and you might have these type of conditions. So there is a list of conditions in the PACT Act, and I can provide that afterwards so you can see the list of cancers and different issues that are now considered presumptive. If you have another issue or someone from Vietnam has another condition that's not on the list, it doesn't mean you can't get service-connected disability. It just means you have to do more paperwork to prove that it was service-connected from your time and your exposure to Agent Orange. Likewise, what the PACT Act did is said, you know, we know that servicemen and women were also exposed to toxins in Iraq, Afghanistan, and throughout their careers. So they've expanded a list of presumptives for folks that have been in Iraq, Afghanistan, over in the Mideast and in different countries. There's a list of countries on the VA's website and a list of presumptive conditions. Not all cancers are on the list. Not all issues are the same. Agent Orange list is a little bit different than the toxic burn pit. So we're looking at all of those conditions. But if you have that, it just means that now it's easier to prove that you have service-connected disability rating. Doesn't mean you're going to get 100%. Doesn't mean it's going to add up to, you know, anything in particular, but it means you'll have access to health care. So the thing the PACT Act did is expanded presumptives, conditions to make it easier to do the paperwork, but it also opened up healthcare opportunities. Many veterans in the past were told, you don't have a service-connected disability and you make too much money, so that you don't qualify for VA healthcare. Right now, with the list of presumptives and how they've expanded being exposed to toxic exposures, many veterans may qualify for VA healthcare, even though you might have been denied in the past. So I encourage all of you to do some PACT Act screening. If you are 100% service connected, 70%, 80%, you think you're fine, you may or may not use VA healthcare, we encourage you to do a PACT Act screening every 5 years. There are a lot of conditions that veterans have that are not on those presumptive lists. The screening not only makes sure that they find that you might have a condition you didn't realize when you're talking to them, but it also lets them do research and say, hey, all of a sudden this Marine Corps unit and these people that were stationed at this base, we're seeing a larger number of folks that have this condition. That's how conditions get added to the presumptive list. So even though you might not feel like you need to get the PACT Act screening, I encourage everybody to do it. If you registered for the PACT Act, that does not mean that you're going to get benefits. A lot of people sign up on the registry and say, oh yeah, I did PACT Act, I'm on the registry. No one is going to pick up the phone and call you. You have to submit a claim. So the reason why I started with the list of what our offices do for you is a lot of times people don't know where to go and start a claim. I talked to a 2-star general last week who runs the reserve component, and she told me, oh, when I leave, I'm going to get a lawyer and they'll help me. You can do that, but you'll be sharing a percentage of your disability with that law firm. They are trained service officers in all of those organizations, your American Legion, VFW, at the state Veteran Affairs Office, they have trained accredited veteran service officers, and at your counties. So you do not have to pay, nor should you pay. And people get hounded all the time. Veterans are one of the most targeted individuals for pension scams because some of the senior veterans are too old and don't understand how to get help. They find someone who will take advantage of them and use their money. And there's some really bad criminals out there that have really taken hundreds of thousands of dollars away from veterans. So we want to make sure everyone is aware that veterans are targeted and that you should never pay to have your claims and benefits adjusted. The VA is not going to send you a bunch of letters. And I have a document to share with the team afterwards that has a phone number in case someone doesn't know, is this a scam? Is this real? Is the VA really calling me to share this information? And some of us might say, of course we know that. But there's the older veterans are really targeted. And so it is a really growing issue because of the PACT Act and people see the amount of disability And a lot of folks just are hesitant. I had a service member, a veteran, work for me at one of my nursing homes, and he found out he had cancer. So I encouraged him to do his PACT Act benefits. He was awarded 100%, and he was back paid 6 years. That was a nice chunk of money, but that's why veterans are also targeted. So if you haven't done your PACT Act screening, if you haven't talked to someone to start a claim and benefit, I really encourage you to go ahead and do it. You never know when you're going to get sick or you might need it. If you get to 100%, your wife might qualify for DIC if something were to happen to you. So if you were to pass away from a condition that was service connected, your wife and spouse might be able to get some of your benefits. So I encourage you to do it. If not for you, then for your spouse. So that's really the PACT Act. I just want to also tell you that if you haven't done your screening, and I'm guilty, and I go to the VA, and my doctors never asked me to do the VA screening. You have to ask them to say, hey, should I do the PACT Act screening? Do it to put the list to increase, so we can increase the list of presumptive conditions. Some people say, well, I had cancer. They gave me treatment. They fixed my, the cancer that I had, and I didn't qualify for any money. That might be true. Not everything is going to give you 20 to 30 to 40% service-connected disability. And sometimes if they fix the problem, you might not be awarded. But you don't know unless you sit down with the VA and actually have them go through your paperwork and let them go through the process and talk to your healthcare provider. So that's really one of the world over PACT Act. Did I miss anything, Brian?
You did good, man.
Okay, so the next topic we talked about, I'll save questions to the end if it's easy, is the TRICARE. So many people are TRICARE retirees. We're all TRICARE Reserve Select or TRICARE for life. And everyone thinks, oh, I get this letter in the mail telling me to sign up for Medicare. And you think, I don't need Medicare. I have TRICARE and I have the VA. Unfortunately, that's not how it works. If you have TRICARE, when you turn 64, you will receive mail that asks you to sign up and start making your selections on Medicare. You have to sign up for Medicare. If you do not sign up by the time you turn 65, the VA will turn off your TRICARE and your DEERS and Rapids. You'll have to go back and get re-enrolled into DEERS and your family members, and you will have to sign up for TRICARE. After you sign up for Medicare, they'll make you sign up for Medicare first. And then they will charge you a fee, and that fee is every year. So you really want to beat that. When you are 64, 6 months prior to your 65th birthday, you will receive mail about Medicare. You have to sign up for Medicare A and B. B is the one that costs you money. You don't need C and D if you have TRICARE, because that includes all your wraparound services, but you do need to sign up for TRICARE, and they will cut you off on your 65th birthday. So just know that that happens. It's not always a nice time to be surprised. If you had children that are using TRICARE, and you notice when they turn 21 and 25 after college, things get cut off pretty abruptly. Same thing is for this when you turn 65 and 64. So that's really the overview that we had. I do want to let you know that if you aren't sure how to help a veteran or where you can send a veteran, your state has the resources, and we are happy to share contact information with any state to help you. So I gave you a really quick one of the world like I did in NGAUS, and I'd love to take any questions that you guys might have on PACT Act, TRICARE, or how to get access to care in your states. An easy crowd.
General Weigel, you and I had talked a couple days ago, and you had mentioned that you're starting to see a trend about Title 32 AGR VA rejections. Could you talk just a little bit about that, please?
Yeah, absolutely. And my former tag was one of the ones that alerted me on this. So there is, you and I and all of us on the phone know the difference between Title 10 and Title 32 AGRs. There are servicemen and women who are being denied disability ratings from the VA because they said Title 32 doesn't qualify. That's only active duty for training. We've been appealing some of the cases, and in some we've been successful, and in some we've not been successful. I was down at the VA last week talking to the head of the benefits. And we are going through this with lawyers to kind of get them to step back to say a Title 32 AGR and a Title 10 AGR should both, if they were injured or exposed to toxins, should be able to get the VA. And unfortunately, right now, I've seen claims and benefits denied. So if you have people in that situation, shoot me their information so we can gather more details and go back and fight this at the federal VA.
And then as a follow-up to that, it looks like in the chat, somebody said, what if I'm still working? I'm using TRICARE now, but should I sign up for Part A at 65, but wait until I retire from my civilian job and then sign up for Part B?
So I would say call TRICARE because they could cut you off. I don't want to say something that's not correct. What I would tell you to do is call TRICARE, ask them that question, and make sure they're tracking your situation. Don't take my word for it. I would call the TRICARE office and ask them because I believe they're going to cut you off at 65, but call TRICARE and ask.
Do we have a question from Judd Lyons?
Hey, Mo, this is Judd. Thanks for doing this. Very informative and great to see you. Quick question on the PACT Act screening. Do you know, is that, I assume you go in person to the VA for that. I think there's an online sign up of some type, but for the screening itself, is that a medical procedure or is it a questionnaire? Just curious if you know.
Nope, absolutely. You could do, actually, they could do it by a telehealth. It is a questionnaire to start. And then if they need to do follow-up referrals for you to get appointments, they will. But it immediately, the initial PACT Act screening is a questionnaire with your healthcare provider or a healthcare provider. So you don't need to be in person. You can call and talk to them. And I have a document actually, sir, that I will send to everybody on the information all on the PACT Act screening and what to do to get your PACT Act screening and the whole process, the 800 numbers, the websites where you can go and do that.
Thanks very much.
Thank you.
One more question in the chat is, are we automatically moved to TRICARE for life?
I'm sorry, what's the question?
It said, are we automatically moved to TRICARE for life?
No, so that's why you have to do that at the 64th birthday is to go in and do your Medicare and then make sure that TRICARE for life, especially for the reserve component folks that aren't TRICARE for life right away on your retirement, to make sure that they contact TRICARE and talk to them about TRICARE for life.
And then the follow-up to that was, does Part A and Part B automatically apply to spouses when they turn 65? Can they use other Medicare?
So A and B, you're going to have to use. Everybody has to sign up for A and B, but your wraparound services, C and D, you can do elsewhere. And I will tell you, when you're using even signing up for Medicare, like I'm in Pennsylvania, University of Pittsburgh Medical Center has a program specifically for veterans that are in that position that have to sign up that is a discounted price. So you can shop around on where you get your Medicare services. And there are some discounts out there for veterans. But if you have specific questions like that, the best thing to do before you turn 65, 6 months prior, is to talk to TRICARE and let them walk you through all the options to make sure you never get cut off or you lose a benefit. Too many people have done that.
One more follow-on to that is, what about the spouse? What if the spouse turns 65 before the service member? Does the service member have to enroll in Medicare prior to the spouse's birthday or just by the member's 65th birthday?
No, so the individual, so my husband's older than me. When they turn 64 and he uses TRICARE, he'll have to enroll in Medicare as well. When he turns 64, 65, I will not. But make sure you call the TRICARE office that you work for, whether it's East or West, and walk through the process with your spouse so that you can sign up for the right benefits.
Okay, and one more, it says for a retiree pre-65, are there benefit differences or one better than the other to have a VA primary care manager, military treatment facility primary care manager, or USFHP primary care manager?
So, I have TRICARE for life and I use TRICARE, but I also use the VA. I like both. I find sometimes I'll go to whatever appointment I can get in quicker. I prefer going to my VA. They send things to you quicker. They respond faster than TRICARE does. So that's a personal choice on the providers you have and the type of service you're getting and what you need. I actually would also say the nice thing about having both and using both is you get a second opinion if you need it. So I encourage you to leverage the two healthcare systems that you're afforded, because why not?
Absolutely. Any other questions? Go ahead and raise your hand if you want to ask a question.
If you don't have a big question, what I'd ask is to make sure you reach out to your National Guard contacts that are still serving and encourage those commanders to have your veteran service officers, your VA or your county directors or service officers come in and talk to your units. There are a lot of folks that have a DD Form 214, and while you're in the Guard, you might not be able to collect your VA service disability, but you can access VA healthcare and other benefits that the state might have. So make sure that we're letting all the National Guard servicemen and women that are still serving understand their benefits and what to ask and think of when they leave service. Because when you go through retirement, no one talks about this TRICARE and Medicare situation or PACT Act screening and continual screening. So make sure they're reaching out and people are talking to them, because sometimes the family readiness folks don't have this information.
Michael, it looks like we got a hand raised from Eric. Can you let him in to ask his question?
Hi, Eric, can you unmute your mic?
Yeah, sorry. Yeah, thank you. I thought she might read it, but it's I'm retired Guard and I'm covered for health insurance by my civilian employer. I work for the state, and I also do receive some VA care. When I retire from my state job, should I enroll in TRICARE for life, or how does that work?
So you can. I would definitely look at your cost and the options. I think TRICARE is pretty affordable. So if I were you, I would definitely look at that that decision. But when you talk to TRICARE, they'll go through the cost, and then you can look at your other options. But I would enroll if you don't have anything else except for the VA. I think TRICARE and the VA are great, great combination. And again, one provides the wraparound services even with Medicare. So if you can do both, I would.
Okay.
But I
you.
would talk to them and look at your cost.
Okay, thank you.
There's another question. Bobby, are you seeing this question in the chat from Phil Killey? General Killey asked if we need any additional insurance if you have Medicare A and B plus TRICARE for life.
That's your choice, but you should have with the TRICARE for life, you'll have the wraparound services, because that gets into your prescription drugs and your eyes and dental. So that would all be on a personal choice. I think you're fine, but that would be something, depending on what your medical conditions are and issues are, if you think you need different extra coverage. Yeah, and these are great questions. And what I would say is I would definitely reach out to TRICARE when you're ready to turn 64, 65, have these discussions, look at your finances, look at the options you have, and talk to them about what's available. And then you could look at alternate options for different healthcare, but I would do a cost comparison and see what works best for you. And if you have access to the VA, I would use that as well.
One other question that was at the very beginning is today in the NGAUS news brief, we get a daily news brief that kind of captures some of the current news stories. There was a story out of Task and Purpose about there being more noise about reducing VA benefits to be able to reduce spending. And I know you don't know what the answer to that is going to be, but, if indeed there was a mandate to reduce spending, what kind of process does that go through, and how long does that take? Is that, are people who are already retired and receiving benefits grandfathered, to the best of your knowledge, realizing I know you don't know, but what can you tell us about that?
So what I will tell you is a few years ago at the last administration, with this current president coming up, they did look at a few options to save money. And one of them was looking at going back to an old rule. Again, this is not out there. It's people are talking about it, which is what I'm sure you're talking about, is if you're a retiree and you are getting your retirement pension and you're getting service-connected disability, to go back and say you get to pick one or the other, you don't get both. I don't know if that's going to happen. I know that was talked about over 4 years ago. It did not pass through legislation. It would take legislation to change that. So they'd have to go through Congress and walk through the process to say, hey, we're going to go back. And that's in the legislation is where they would discuss who may or may not be grandfathered. I would imagine that folks would be grandfathered because there are people retired now that, have planned to live off their pension and their VA disability. But that's just one area that people talked about. I don't know what's going to happen. Obviously, new administration coming in, they could have different ideas and they'll vet it through Congress. But right now that's just people are talking about some of the stuff that was brought up in the past and saying that this could happen again. I'm just not sure where legislation and the senators and Congress stands on that, nor the president. I just know it was talked about 4 years ago and people are talking about it. And that's the one that I've heard most recently of looking at retiree benefits and whether or not you should get both your pension and your VA disability rating. If there's anything else, again, it would probably go through and need legislation to change it. And so it would go through that process in vetting. But that's where if you're active with NGAUS and MOA and your American Legion and your VFW and Marine Corps Leagues, any of those organizations that you get involved. And if you start hearing people talking about it, those organizations in their states, because they all have state leadership and then they have national leadership, they could be force multipliers to what NGAUS is doing. So we should all make sure that the service organizations are on board with the same talking points and are going down and talking to legislators.
Yeah, that's a great suggestion. Glenn writes, this might not be the right forum, but are there any long-term care insurance options available for veterans?
There are long-term care, not just specifically for veterans. It would be standard. I haven't seen a specific veteran long-term care insurance. There's mixed reviews on whether or not some of the experts in the Healthcare Association think that long-term care insurance is valuable. But if you'd like, I can send you some information on that. Like I said, if you're 70% or more disability rating from the VA, the cost of care is pretty much covered by the VA in the long-term care facilities, but it doesn't help your spouse. So definitely something to look for if you have a family history of pre-existing conditions such as dementia and Alzheimer's. Those are the most expensive levels of care at a skilled nursing center because of the amount of staffing and the care they need and the security around it. But I could send some information on long-term care insurance and you can make your own decision. I've heard things both ways from different experts in that area.
Yeah, that'd be great. We'll take any information you have and send it out as a link or an attachment when we follow up after this presentation. So thank you for that.
Mm-hmm.
Mark asks, what's the biggest thing you think Guardsmen can do to prepare for retirement?
So, pilots won't do this, but other than pilots, I would say make sure your documentation is up to date. Don't assume that you don't need line of duty investigations and you don't need paperwork. A lot of times, especially AGRs, you just think it's all in your record or it's not in your record, but you're fine and you wait to the last minute. If you're going to go through a retirement brief, if you're AGRs, definitely when you're getting your retirement physical, you talk to them about every issue that you may have had or have. Get it documented in your record. It makes it a lot easier. If you don't have that, try to go back if you can do a line of duty and do it. Same thing with our traditional guardsmen and women. Encourage them to do the paperwork. Sometimes no one wants to do the paperwork for a line of duty, but looking at the folks getting denied and how hard it is to go back and get documentation to prove a service-connected issue, it's because people don't want to go to sick call or don't want to tell someone that they got injured on a drill weekend, and then they're suffering afterwards. And it's not impossible, but it just makes the paperwork process a little more tedious if they don't have that documentation. So the best thing to do is make sure everything's documented in their records. And then know that these offices exist in your state. And if you don't know the answer and your staff doesn't know the answer, call our offices and we can help come out and do briefings to your units. Encourage them to talk to our offices.
Perfect. Thank you. Also, can you talk a little bit about the process for burial at a veteran cemetery? Joe Lyons just said he went through pre-eligibility, and a lot of folks don't really know this, and he kind of heard about it word of mouth. Can you just sort of talk a little bit about that process, what's required, what's involved?
Absolutely. So that's why I have Brian sitting here. So that's Brian's forte. He works with our cemeteries here in Pennsylvania, and he does a great job. So I'll give it to the Marine.
Thank you, everyone. Nice to meet everybody. The pre-need is kind of a confusing document. So it does not guarantee a burial place. It just takes a point in time look of, yes, you're eligible, put this in your safe box with your DD 214. The most important thing about burial is to make sure that your next of kin is informed. So by that, I mean, where's your DD 214 at? What are your wishes? Do you want to be cremated? Do you want to be embalmed and interred in the casket? If there's more than one national cemetery in your area, what's your preference? And when the time comes, one of the things you're paying the funeral director for is to set that stuff up. They'll call the national cemetery scheduling and get things set up. They'll take care of the honor guard details. They'll take care of the flag on the coffins. The pre-need form was really born out of exactly these questions. We get lots of questions on our VSO line every day about, hey, I'm getting sick, I'm getting old, my spouse has some serious health needs. How do I plan for this? And the form was made as a bureaucratic way for the VA to answer those questions. You still have to not have a disqualifying event. So if you get your pre-need form back and it says you're good to go, and then you go and hold up First National Bank the next morning, that form's all moot at that point, right? Because you have a capital, well, not a capital crime. Capital crimes are certainly disqualifying, but what I'm getting at is things can change after that. So it's not a guarantee, and there's no policy in the National Cemetery Administration to reserve a grave, with a couple of exceptions, of course, because we all know any good government policy has a caveat, right? So if your spouse dies before you, your grave's reserved, right? No matter how that works. If the non-veteran spouse goes first, then you still take your DD 214 to get your eligibility and to get them into what's going to also be your spot for internment. So that's one of the ways that you get a spot reserved, but somebody has to pass first. So what my advice is always is keep those documents in a firebox. Make sure your kids, your spouse know where they are. Make sure that your will's there. That your DD 214 and your wishes for interment should all be together in there. And that form, if you've done that form, it's not a requirement, but it's good to be there too, because part of that asks where you want to be interred, how you want things to go. So it's a good thing to do.
And I don't know if I missed it, but the form, can you just get it online and fill it out, submit it online? Do you have to go in person to an office?
No, you can pull it down online, and then at the bottom of it, it tells you where to send it. You can do that electronically, and then they'll send you an adjudication back.
And that's at va.gov.
Correct.
va.gov is a great resource that they'll have information on PACT Act screening, Agent Orange, burial. I saw someone ask a specific question about Arlington. All of those offices can be reached at va.gov. And I'll tell you, we do a lot with spouses when someone passes away, whether they're young spouses or older spouses. There's a lot of misinformation out there. Spouses whose husbands had 100% disability and died from service-connected automatically, I think they get the DIC. You have to be 100% for 10 years, but that doesn't mean we can't get it. So the spouse will be denied the DIC, and then we can go in, our offices or VSO, and help you fight to get those benefits and show them that the death was because of a service-connected disability, which it's really important that the death certificate has the condition that is service-connected to make sure that the spouse can get the DIC. We've been really proactive in helping spouses. We've had Vietnam veterans that have been deceased for years, and it was because of Agent Orange, and now they would have been, presumed. So we're going back and helping some of those spouses get their benefits. So it's about $1,600 a month. So it's, very helpful to those spouses. So it's, again, Brian's point, making sure that you and your spouse are informed of burial and benefits so that they know how to access those benefits. And children as they get older, caregivers, whoever the caregiver is going to be.
Great. Any other follow-up questions on the burial cemetery issues? I see one hand up. Jeffrey, I think you can go ahead and unmute.
Just like to, excuse me, I'd like to point out that there may be states out there, for instance, New Jersey, they have their own state veterans cemetery, as well as several county veterans cemeteries. I don't know about Pennsylvania, whether they have them or not, but there's many states out there that I understand have these types of facilities, and they're well kept, well maintained, and for instance, our little one there in Cape May County, where I used to live, we had about 5,000 soldiers and sailors, etc., veterans buried there, and to include your spouses. So look into those things too. And they follow the criteria of the federal cemeteries and the rules of the federal cemeteries, basically. Thank you.
No, thank you. That's a good point. The federal government is getting a way of building more federal cemeteries, and we all know that some of the federal cemeteries are running out of room. In Pennsylvania, we have 2 that are full. We have quite a few more, but most of ours are federal. We have 1 state that's at our nursing home, one of our homes. But definitely look into those options. And what the federal government is doing now is grants with the state. So they will give the state a grant to run a veteran cemetery, but then the state will take the maintenance and the care of that cemetery over. So there are, opportunities in different states to grow more cemeteries, and that's how the federal government is doing it. They're getting away from some of the federal, but using grants and doing co-ops with the states. And if you have any questions on, areas that you think your state should grow, I can put you in contact with the folks down at DC. So the federal VA cemetery folks still look at all of those cemeteries, state and federal.
Are you having a hurricane there, Mo? It looks like your power is going on and off.
I'm in the federal building here in Pittsburgh. I don't know. It's not even snowing out. It's not Erie, so I don't know why it's doing this.
It's energy conservation. They
Forgot
have
to pay the bill.
a timer on the lights.
She knew.
You need to get that Marine to dance around a little bit in the background to keep that from happening.
I'll be right on that, Mike.
Yeah, and for those who are advising people who are getting ready to retire, Gerald has a great point that to make sure that you have copies of all your military orders before you retire. Sometimes that's hard to get once you stop having access to all of the systems. But along those lines, and then I'll come back and ask about the Major Richard Starr Act, but along those lines, who does someone reach out to get a final 214? Because he said the one he has doesn't cover the last 4 to 5 years of service. Is that just the local personnel office from where he retired?
I mean, you can get it from various places. Your personnel, if you were, your G1 office can get it. The retirement services offices in the state can get it. Our offices can get it. So there's many that can help you get your final DD Form 214 if you've not gotten that.
I think that's one of the huge advantages of being in the Guard versus some of the other components is anything you need, you should be able to go back to your state headquarters and somebody there should be able to help you with any documentation or any of that kind of stuff. I think that's one of our huge advantages. So hopefully your G1 office, as Mo said, will be very helpful.
Yeah, the folks who struggle the most are folks that were pre-Korea War era. Some of those documents are a little harder to find, but that's when you can reach out to your state VA office and they should be able to go and help.
I can't see the name. Is it
Robert.
Robert? You can go ahead and unmute yourself, Robert.
Yeah, easier said than done. It took me a minute to find it. I just want to mention to this audience that not all county veteran service officers and post service officers, et cetera, are the same. There are still some biases out there concerning National Guard service, and some VSOs are not as supportive of traditional guardsmen who are going through retirement services. So I just encourage everyone to talk to the folks that have gone before you, and don't be afraid to move to another county. You don't have to stick within the county. You can receive services from whomever you want. At least in Nebraska, it's not required to stick to the county. But don't be afraid to vote with your feet. There are still, unfortunately, some curmudgeons out there who don't see reserve component National Guard service the same. They're just there to take care of the active duty. Over.
No, true point. And what I would say is make sure you find a service officer that you think is serving your best needs. It might be at the county, it might be at a service organization like an American Legion, it might be at the state headquarters. There are many accredited veteran service officers. And if someone is not taking care of you or shows that you have a bias, you can report that to your state VA office. We take those very seriously and work with the counties. And, you know, there's ways to remove service officers who are not taking care of all veterans. So you definitely have any kind of questions and concerns about that, we can help you get to your state Veteran Affairs office.
One more question. It says, do you have any insight in regards to the Major Richard Starr Act and if you see it getting passed?
Yep, hold on.
So the STAR Act is of interest here because of retirements and your benefits. Right now, you have to be 20-year retiree and then have 50% or more to get 100% of both entitlements. The STAR Act has gone through several legislative sessions. It has not been moving fast. I would suggest that this body and your states and get a grassroots movement together to help get that pushed through. General Weigel spoke a little bit about a way that they propose to reduce payments from the VA by making you choose your retirement or VA benefits. So the STAR Act would be the opposite of that. Certainly advocate for that as a body and then go out to your other chapters.
Thank you. And last note here from Mark Sheehan, it says, for awareness, those planning to apply for their technician FERS annuity, the OPM website directions were not real clear for those of us who left federal service years before applying for FERS retirement. Also, the website advises to apply 2 months before the desired date, but when I got in touch with the office, it's really a 4 to 6 months backlog. So thanks for that. And I'm reading these because in the video, I don't think you can see the chat. So thanks for bearing with me here.
Hey, Bobby, I just want to make one comment. We talked about burials and we talked about the cemeteries. I want to let you all know, I'll give my public service announcement that December 14th is Wreaths Across America Day. That's where they want to make sure they put a wreath on every veteran's grave site, or whether it's, you know, to recognize servicemen and women. One of the things at the ceremony they'll tell you is, you know, you die twice. One when you take your last breath and one when someone stops saying your name. So they are short wreaths. So you can go on to the Wreaths Across America website, and for $17, you can sponsor a wreath for a veteran. I know someday we all want wreaths at our site, so we all have to chip in now, and they're really short this year. I think they're 50%.
For our cemetery out there, but
Yeah.
it touches all the national cemeteries many of the state and private cemeteries as well. So those wreaths are all sponsored by somebody. They're not donated from the organization. Somebody has to pay for those.
So just want to put that out there. And if you've not attended or done one of those ceremonies, they have a great one in Arlington and at almost every federal cemetery across the country. And they're amazing ceremonies.
That's good to know. And you said that they need all of that funding by the 14th, by 14 December?
You have to sponsor, you go online and you pay the $17 and that's how they get the wreaths to the events.
Yeah, and so the wreaths are all shipped on the 13th, 12th and 13th. So time is getting very short if you want to sponsor a wreath for this year. They all come out of one farm in Maine for the Wreaths Across America program. So it's a very specific thing. I'm sure if you want to work with the cemetery in your areas and provide wreaths another way, I would highly doubt you would get turned away. But as a program, Wreaths Across America is very specific where they come from, how they get there, what day they're put on.
Awesome. Thanks for that. Looks like the last note I have here, it says, this is back to getting all of your orders. It says if you're Air Guard, you should have all of your orders in arrows prior to 2005 so that your tag office can request them. Your DD-214, your IPR office can help you with that. And that was the last note I have, unless I missed anybody. If I missed anybody's question, please go ahead and raise your hand and we'll try to get any other questions answered. And also, I know we're getting close to the 1 hour point, so if you have to drop off, no problem. This is being recorded and we will send a link, so you can always come back and watch what you missed later if you have to drop off a little early.
Hey, Bobby, should we thank Mo and move on to the next topic?
Let's do it.
Hey,
Mo,
Mo, thanks very
Thank you
much.
for having me. I will send you some emails that you can share with everybody. And if anyone has questions they're afraid to ask online or specific questions, you can share my email and I'll be happy to connect them to their state contact or answer the questions. And I'll share all this other information with you after this. So thank you all, and thank you for dialing in.
Thank you.
All right. Okay, Bobby, do you want to start the covering down on November board meeting with your strategic planning information or anything else you have for the board meeting?
Yeah, absolutely. I'll jump in to the strategic planning and then I'll let you cover the conference. So at the recent November board meeting, we passed a motion to develop a strategic planning committee. We're standing up a strategic planning committee. The last time NGAUS has done a strategic plan was 2014. It's been 10 years and it's high time with all of the changes in the world that we come together and really look ahead. And so I'll just share with you a few of the focus areas that we're going to be looking at. I'm the chair, Maria Kelly, Brigadier General retired, working at NGAUS is my co-chair, and we'll be looking at mission, vision, and goals, both near and long term, looking at fiscal matters, trying to understand our current revenue streams and grow those so that we've got more predictable and constant revenue generation, looking at how we communicate outside the organization, so strategic communications, trying to increase our membership, opportunities that may be available for the memorial building, the museum, and the library, looking at expansion and fundraising for the National Guard Education Foundation, doing a stakeholder analysis, and really just looking at how NGAUS is an influencer on Capitol Hill as a strategic thought leader and an influencer to the PPBE process. So just a heads up about that, and to let you know that obviously retirees are a huge source of institutional knowledge and thought generation. So as we begin to launch this committee, we'll be looking to you. You'll probably see some information advertised looking for folks who are interested in either helping with that effort or becoming part of a focus group to help us with that effort. I'll send it back over to you, Mike, for the conference summary.
Okay. Yeah, thank you. A couple things from the last conference that we had. The retired separated breakout, the luncheon, was very different than what we've done previously. And for the most part, we had received very good feedback from it was fun and exciting and all those kind of things. But one of the drawbacks was it was hard to hear the presentation, which is why we brought Mo back to kind of cover down on that information again. And we get that anytime we make a change, there's some people that are going to be unable to attend. You know, we got feedback that if you're going to do something like that, it would have been great if spouses could have been engaged, which we agree. You know, the host state puts this on and they did a great job. You got it fully sponsored to include drinks and food and everything. So it was an awesome opportunity. You will see, we did get a briefing at the November Board of Directors meeting in the General Conference Committee. And should note that both of the co-chairs for the Milwaukee Conference in Wisconsin next year, they're both retirees. Brigadier General Mitchie and Colonel Retired Hinman, both retirees that are working this conference. And so just again, another example that just because you're retired doesn't mean you can't be fully engaged and involved. They are still working on the details for the Milwaukee Conference. We did tell them it'd be okay if it's off-site. You know, they're potentially looking at the Harley-Davidson Museum. I don't know if that will come together. But whatever they do, we need a space that we can have the actual meeting in. And then after the official meeting, we can do something where we're maybe moving around. As Bobby mentioned before, we will have the air elections to do. And then we also want to make sure that we have an opportunity to put information out prior to getting, you know, into any kind of extra social things. We're also intending at that meeting to try to get some of our new leaders, right? Then we have a new chief, new Army director, new air director, and we will invite them. Chief first, and if the chief can make it, we'll probably just have one at this one and then try to cover down on some others. But we know you want to hear from the senior leaders, especially when they're new in the job, and ask questions and stay engaged that way as well. So one of the comments in the chat today was, can we get a similar briefing from TRICARE like we had today on VA? Absolutely, that is our intent. Either at the next meeting, which we intend to do in the April-May timeframe in the spring after our March Board of Directors meeting, and or at the August conference in Milwaukee. So we know TRICARE is another really important thing for our retired separated community. And so that is part of the plan for that conference. The conference update from Wisconsin, you know, Milwaukee has hosted this conference multiple times before. They even have some people that were involved the last time they hosted it. Every indication is it's going to be really well run, well done, and the format will be awesome. And we continue to look at new ways. I serve on the conference committee. In fact, this last November meeting, I was appointed as the chair of the conference committee, which to my knowledge is the first time a retiree has been in that position. So I'm excited and appreciate that honor to do that. And we'll have the best interest in August at heart as we go forward, trying to look at some new ways that we can make it kind of new and exciting, but honor the legacy of August as well by making sure that we do some of the things that traditionally have been very important to us. So watch for more on that. And we'll be looking for your input at the next August conference through a survey to try to get additional information to make those changes that we think are effective for all of our attendees. Speaking of surveys, at the last conference, we did a survey. We had, I would say, moderate participation, but of the participation we had, over 90% of the people that responded said that the meeting was either productive or very productive. And so I think that's great feedback, but we want to get better in how much feedback we're getting and the types of questions we're asking. And we only asked, I think, 1 or 2 questions about the actual meeting and that conference, but more of the questions were, what can we do different going forward to get better? How do we push out better information? How do we more engage this community? You know, we have thousands of retired and separated individuals. We had only had 155 sign up. We had about 80 show up. And so we want to get more engagement, but we know we have, you know, people's time is valuable. So we want your input. We're going to ask for that. The next time we do a survey like that, we'll send it out to both the attendees, but we're also going to send it out beyond that to try to get information from those people that can't be at the conference or don't make it there. The other thing that happened at this most recent Board of Directors meeting was we were fortunate, Bobby and I were fortunate to be able to receive, on behalf of the Retired and Separated Caucus, the Legion de Lafayette. And each year, or at each one of these deals, when NGAUS does their Legion de Lafayette ceremonies, they do some internal ones where they pick organizations or people to honor by making this contribution and doing this LDL on behalf of that community. And it was decided by that foundation and the people that they bring together to decide that this year they would do the NGAUS Retired and Separated Caucus. And so it was an absolute honor to stand on that stage on behalf of all of you and all of those out there that are not on this call today, and recognize that, you know, the this is the foundation upon which the future of NAUGUS stands. And to be able to receive this honor on behalf of all of you was incredible privilege. And so I wanted you to see the certificate. You should see it on your screen right now. We have the actual document that was given to us, and we'll figure out a place for that. We'll probably bring it to the conference next year so that folks can see it. But I'm certainly proud to do that. The Educational Foundation does great work to continue and ensure that the legacy of our National Guard moves on forever. And so what a great honor. So we just wanted you to see that as well. Bobby, what am I missing from the conference and or the November board meeting?
I think you covered all the things that were relevant for this audience, Mike.
Okay. So I guess at this time, what we're really looking for, and appreciate you sticking with us past the 1 hour mark. As I said, we had it locked for 2, but I know we won't need that. We're really looking for additional topics. I see, I just saw this. Mike Hinman is actually on the call today. If you have any questions for the upcoming conference, you can throw those in the chat, and we'll either have Mike jump on and answer them, or we'll at least get those to him. Thanks, Mike, for sending that in. I did not know you're going to be on the call. That's great. Mike, do you have anything in particular that you want to add before we move forward?
No, again, I'm evaluating options for the retiree caucus / meeting for Milwaukee, and certainly we could stay at the Baird Center, make it easy, but I know you're a Harley guy yourself. Don't know about Bobby, but if we could tie in something with the museum, I think that'd be beneficial. So we'll go that route. I got a couple of ideas that we'll pose to you and Bobby going forward, but we'll have something for you by the NGAUS conference. So if there's something you want to tour, I don't know if you're going to be there or not at NGAUS.
I'll be at NGAUS.
Bobby will be, okay. Yeah. We could roll out a couple options, and if you want to go take a look, we're certainly right there in Milwaukee. So other than that, I have nothing else to add. Be glad to field any questions if there are any.
And I don't want to put you on the spot, Mike, but you are planning to give a brand new Harley Davidson away just to our luncheon, right?
Yeah. How do you say that? We are looking into doing what we did in 2011, but not just for retirees.
All right, fine.
I thought that was a big hit. Yeah, I think it was a big hit. As you know, the corporate sponsors and the showroom really was a flurry of people. They had to be present to win that Harley, and so we're talking to Harley about doing the same. So.
Okay, perfect. Yeah, thank you, Mike. I do think that would be great if it was available, obviously, conference wide. So I guess one of the last things is we're looking for your input. How do we make this better? How do we make it more effective? What topics should we be covering down on? Both for the retired separated community, but also where should we be engaging in general as it refers to NGAUS? We had a couple things come up today that certainly we can all play a part in locally in our own states, but also as a group and push something forward through a resolution through NGAUS. But are there specific things that you want to see addressed in this community or in these future calls? Again, a reminder, our intention is to do this call twice a year, and we'll do it in this time frame, the December time frame after the conference and the November Board of Directors meeting, and then in that April-May time frame, which we'll cover down on the March meeting. And then we'll have obviously our meeting together at the annual conference. And so if you have thoughts, ideas, things that you would like to see us address, we're asking you to please share those. We can only address things if we know that there are things that you want to have talked about out there. And so anything you can do to help us with that would be greatly appreciated. You can throw them in the chat now. You can send them probably to me, since Bobby's now moving on, and we'll get April engaged as she comes forward into that role. And I'm going to drop my the best email to get a hold of me in the chat.
Some of the notes I took just as possible topics had to do with the long-term care of the VA homes. So we could probably bring somebody on that can go into quite a bit more detail about that. Definitely TRICARE, potentially some more that would involve the burial information. But yeah, if there's other ideas, we would love to hear them. Also, we'll be forwarding out a link, obviously, to this video, so you can go back and watch it if you want to. And we're also hoping to put some more information on a more regular basis in the NGAUS magazine. So the link will also be in that eventually, along with some other programming that has to do with retirees. Looking for your thoughts and suggestions on that as well.
And hopefully even a spot on the website that is, we don't want to get too carried away here and try to make everything about this group, but we do want to have an opportunity for dialogue and input. And obviously there's some incredible minds and workers and everything else in this group. So we're looking into all those things, and hopefully we'll have more information for you at the next one of these calls. Bobby, unless you have anything else, I think we've kind of covered down. Again, thank you so much for your time. But did you have anything else, Bobby, before I close it out?
I don't know. I love the idea about more information about spouses, though. I'll add that to the list. That's a great idea. I have nothing else other than just thanks to everybody for participating and hanging with us.
Yeah,
Joe,
appreciate. Yes.
One last item. I know I spoke with you and General Durham-Bust about that I sit on the Air Force Retiree Council at Randolph. I'm one of 15 area reps. And it kind of the point is, I don't know that everybody on this chat, I know we're speaking about NGAUS, we're talking about officers and warrants. These retiree offices residing in the states, they're starting to be far and few between, but they're really significant for Guard members. It's an opportunity to reach out for help with paperwork, retirement paperwork, TRICARE. They're very knowledgeable. For the Army soldiers on the call, it's the equivalent on the air side of your RSO, your retiree service office. We don't have such a thing on the air side. I'm surprised we don't, but I think it's something that could be looked at in the long term that might be beneficial. And an example is Mark Mitchie, General Mitchie, my co-chair, got walked through all his retirement, all his questions answered by a human being, everything filed for him on his behalf. On the air side, we have to go to the Force Support Squadron at the local base, and it could be active duty base they serve as well, could be the Guard base. But these retiree offices are kind of a link to answer anything you want to know about anything. They're usually staffed by Army and Air retirees. In our case, I got an 85, 83-year-old here in Madison, Wisconsin, that run that office. And they're not going to be running it forever, obviously, but they're a good link for people to get information. And I'm not sure how knowledgeable people are that those offices exist. Bobby, I think you're from Iowa. We talked before that you don't have one in Iowa, and that's true. That's one of my 8 states I represent. They're kind of a dying breed, and COVID did a really good job of putting a fork in many of these offices. They're required by active duty to have a retiree. They're not so. Out to those people in Wisconsin, we have no active duty, so we have 2 retiree offices, and we're very fortunate. Iowa doesn't have any. Minnesota doesn't have any. The only states I have active in my 8 are South Dakota and Wisconsin. The other 6 states are silent, and they defer all of that to the Force Support Squadron for assistance. It seems to be working. I don't hear any big complaints from at least my area responsibility. But I don't know if there's a tie there that we could benefit and do more outreach and communication. Maybe it's part of the strategic planning effort, Bobby. I want to know how I can help or do my job to help represent retirees in my 8-state region. I'm one of 15, so we're all over the place and in Europe and Japan. But there are only 2 of us that are area reps that are Guard, though. The other 13 are active duty retirees. So it's a great for things to be addressed by the Chief of Staff of the Air Force. He's who we report. But I just throw that out there. I don't know how it all fits, but I would like to figure it out. I've got a 4-year term and I'm 1 year into it. So anything I can do, I'd like to be part of it to help out.
Thanks, Mike. Over
to you.
Yeah. Thanks, Mike. Appreciate that a lot. If you need somebody to go do an in-person visit with the Germany and Japan office, I'm your guy. So thanks again. Appreciate that. Ed, I appreciate your comment on there. I couldn't agree more. We'll continue to do that. And we'll continue to have these things and build on this. So continue to push information. You've got my email address. I dropped it in the chat. And again, thank you so much for your time. Thanks for who you are. Thanks for your service. Merry Christmas to everybody. Have a happy new year, and we'll see you in 2025. Thanks very much.